I'd like to bring your attention to the website of Speech Pathology Australia. You might not have seen it recently. It's had a revamp, and this is the ethics page. And if you go and have a look, and particularly if you're a member, there is highlighted there the ethics education package, which is here. As an example of it, you can download it or you can do it online. We're very excited because the ethics education package is going to go into e-learning very shortly to be launched next year. So look for the online modules of education in ethics for Speech Pathology Australia. So I'm really delighted that Belinda's here. Because she has a huge amount of experience in ethics and has written a lot of papers, and we have some references at the end of this presentation. These are the members of the ethics board currently, and you'll notice Belinda and I are two of the elected members, and we also have a reserve pool. What are we going to do today? Well, we're going to have a look at the code. So this morning you should have all got a copy of the Code of Ethics in your handout that you received when you came in. I think we killed a few trees today. There's so many bits of paper. But you should have a copy of this. You will need that later on. We're going to do a workshop activity, as I said. We're going to do a planning activity for yourself. What you want to do ethically, what you want to take away, what you want to do in future. And the other thing, which is the sheet on your tables that is a log sheet, as we're talking today, I'm sure some of the people at your tables are going to say, I had this situation where, okay? And they bring up a really interesting example. One person at your table is going to be the log keeper. I want you to write down that example on that log sheet. The reason we're doing this is I'd like, with your permission, to take that back to the ethics board and to take it back to the Board of Speech Pathology Australia so that we can deal with real life examples. Is that okay with everyone? Yes?
What does the log sheet look like?
Where is it? There. Yep, it's just one log sheet per table, so just one person will fill it in for the table. Okay? Everybody okay with that? Okay, good. Okay, what is the goal of the Ethics Board? Well, to support the profession in moving from a reactive model to a proactive model of ethical professional practice. The Senior Advisor for Ethics and Professional Issues is Trish Johnson. She's located at head office at SPA in Melbourne, and she responds to queries from speech pathologists or members of the public. She provides advice. She manages processes with complaints. She provides education to members, and she also represents Speech Pathology Australia on several working parties and committees. So an example, last year Trish had 104 contacts which were queries from speech pathologists. On what areas? Well, 24 on advertising, 11 on professional conduct, including observing employer policies, 10 on informed consent and confidentiality, 10 on clinical records, 9 on professional integrity and collegial relationships, 9 on employment conditions, including professional support, 8 on scope of practice, 8 on delegation, autonomy and complaint procedures, 7 on conflict of interest, 4 on competency, and 4 on volunteering and free services. They were from speech pathologists. From the public, she had 21 contacts regarding clinical competency, 9, business practice, 4, informed consent confidentiality, 3, access to service, 1, professional integrity, 1, client autonomy, 1, and 1 non-member complaint. So formal complaints come through a process, and the ethics committee looks at each of those complaints, see if there is a case to answer, and then make recommendations to Speech Pathology Australia Board for actions following those complaints if they're found to be in breach of the Code of Ethics of Speech Pathology Australia. Okay. The ethics log, as I said, will be a real-life ethical issues that people come up with, but when you do it, only related to dysphagia and disability, not all of the areas of ethics, because we'd be here forever, okay? Just wanted to tell you that we will send that through. What does the Code of Ethics value? It has three main areas: values, principles of ethics, and standards of practice. It's really worthwhile to review these every so often, because although we might think we're being ethical practitioners, sometimes it's really good just to have a good look at what is happening, and also maybe what is happening in our context or as contexts change. So as we go into the NDIS and we change into a lot of different modes of delivery of services, our ethics will be challenged. So we need to be making sure that we're proactive and that we're looking to the future and making sure that we know what we're going to be able to do. So today we're going to work through 4 different ethical scenarios. These tables, 1, 2, 3, 4, they all have the same scenario, but they're going to be analysing it in a different way. Okay? So you all have a scenario that starts, "Hello Trish," right? Then another 4 tables have a scenario that starts, "A manager of a nursing home." And then another 2 tables have a scenario that starts, "You work in a community." And another 4 tables have a scenario, "You've been given a referral." What we're going to do is you're going to work on those, looking at different analyses, and then when you've done that, you're going to swap with the table that had your scenario and see whether they came up with the same sort of things using a different analysis. Okay? So, what do you do if you're faced with an ethical problem or a dilemma or an issue? Speech Pathology Australia did a workshop at the conference in Perth in May, and it was called "Can Ethics Help You Sleep at Night?" Well, hopefully ethical problems don't keep you awake, but they can. You can worry about them. So there's no right way, there's no wrong way to look at the approaches of ethical reasoning, but Dr. Belinda Kenny has published many articles in this area, and she's going to talk us through 4 approaches about ethics.
What we were hoping that you'd really get out of this first activity this afternoon is to really start to get into the headspace of what is ethics and what are ethical dilemmas. Because one of the things that's really important to think about with ethics is that it's not just about when something goes really bad. I think if I gave you an example and said, you found out that somebody in your organisation was offering to move people up on the waiting list if they were to give them some money, I think everyone in this room would agree and say that's not ethical. There'd be no dilemmas there. I think we'd all be in agreement. But as you probably found out with the cases, that ethics is often not about black and white. It's often about complex areas, about grey areas, and it's really part of all of our professional practice, from how we manage individual clients to how we plan and deliver our services to how we evaluate what we're doing as speech pathologists. Felicity mentioned that I'd be talking about 4 approaches this afternoon to resolving ethical dilemmas in your workplaces, and I'll start by saying they're not my approaches. I've actually borrowed from hundreds of years of philosophy to come up with the 4 approaches that we'll talk about this afternoon. So the 4 main approaches that you'll be putting into action in this afternoon session are the principles-based approaches, casuistry, narrative ethics, and ethics of care. I have a summary up here and I'll go through each of them in a little bit more detail, but the summary is here, I guess, to show you that there are completely different perspectives for the way that we can think about ethics. A principles-based approach is really thinking about our code of ethics and which principles might be at stake when we come across an ethical dilemma. Casuistry is really using professional experience and how we use our expertise in a particular area and the work that we have done with a particular caseload to help us and inform us when new ethical dilemmas arise. Narrative ethics is really aligned with person-focused or client-centred care and thinking about the individual who's at the centre of that ethical dilemma. And ethics of care focuses on relationships, so our professional relationships with our clients, our carers, and also with our colleagues and other organisations as well. So let's go through them perhaps in a little bit more detail. The reason that we picked out the 4 approaches this afternoon, and they've been incorporated by the Board of Ethics, is that we felt that these 4 approaches probably most closely reflect what happens in speech pathology. So they include how we use evidence and scientific thinking, how we use our professional experience, our focus upon clients, and our focus upon communication to resolve issues at work. The principle-based approach is probably the most logical step-by-step approach to thinking about ethics. So what you may be thinking about here is, what are the important facts or the evidence that I need to consider in this particular scenario? Is there a problem here? So is there an actual ethical problem that I need to think about? And you'd be defining the problem using those principles that are in your code of ethics. So is it around benefit? Is it around harm? Is it around fairness in my work with the clients? You would use that information to come up with a decision and an action plan, and think carefully about how you may evaluate the outcomes of that in the particular scenario. Because this is a very structured model, it's often particularly helpful for new graduates or people who are new to a clinical setting or perhaps new to a caseload. But the approach can also be really helpful if it's a very complex ethical dilemma and there's perhaps conflicting perspectives from the people involved. And what you really need to do is to take a step back and think about, what facts and what information do I have available to help me resolve this issue? Casuistry. This one has its foundations in the law. So if you think about the law, and often if you watch any of those legal shows, they often talk about precedent cases informing current practice. And that's very much what this approach is about. So what you'd be thinking about here is using your professional experience, not just your professional experience, but also thinking about evidence that the profession has collected and perhaps talking to other colleagues or members of the community of practice who have experienced similar issues in their own practice as well. What you'd be thinking about in terms of the ethical dilemma are questions along the lines of, what are the most important issues here that I need to come to grips with? Have I managed a case like this before sometime in my professional practice, or a similar case? Then you'd start to compare what happened in the previous case. Is this case the same, or what may be some subtle differences that might influence my response here? Then you need to think about, how does your response link with the standards of practice and duties of care in the Code of Ethics as well? Moving along to ethics of care. As I said, ethics of care is really about professional relationships. Ethics of care has its groundings in feminist writings, and it's really been drawn from understandings that initially women in particular have long-standing experiences with caring for others. And from that, they develop particular skills and attitudes towards caring that can help inform the way that we provide services to clients. In more recent years, it's been applied much more widely, and it's not seen only as a feminist approach, but something that really helps us think about the values that we have in healthcare and what's important. So things like how we respect our clients, how we, include them in decision making, how we demonstrate compassion for our clients, how we really think about advocating for our clients as well. So some of the key questions that you may be thinking about if you're using an ethics of care framework are, what are the needs of the individual and their family who are affected by this dilemma or problem? And in particular, you're thinking about the people around your clients. So how could they be impacted? Most importantly, what are my roles and responsibilities as a healthcare provider, and also the roles and responsibilities of the healthcare team that I'm part of as well. Part of this approach is thinking about sort of power dynamics and whether people have an opportunity to have a voice within the healthcare system. So what you'd be thinking about is, are there any barriers here to me providing quality of care to my clients? What sort of resources may I need, whether it might be increasing my knowledge, whether it might be practical resources, whether it might be staffing. What sort of resources do I need that are going to enable me to provide the highest levels of service? The other important part of this is thinking about how clients are actually responding to the service that we're providing. Are we actually asking our clients about their experiences with our service? What sort of things are they indicating are strengths or areas that need to be further developed in order to meet their needs? Importantly then, what can I do as an individual to improve care, and how can I most strongly advocate, particularly around communication, and because we're talking about dysphagia today, swallowing for my particular clients. This approach here, if you're working with this approach this afternoon, will link very closely to the duties in your code of ethics as well. What is it that I'm expected to provide? The fourth approach is the narrative approach. And this approach is really directed towards an individual. So the individual is right at the core of your decision making here. It seems a lot like ethics of care, but I think whereas ethics of care looks at care networks, this is very much the client who's central to your decision making. Some of the questions that you may be asking yourself are, because it's a narrative based and it's from narrative medicine, we often talk about it as people telling their stories. So you'd think about, who are the most important characters here in this particular story? So clearly the client is the first character that you would think about, but who are the other people who are important to my client, who we need to talk to, who we need to consider their viewpoint if we're making an ethical decision? Then we need to think about how empowered are our clients to actually tell their story within my organisation. What active strategies are we taking to facilitate people being able to communicate their background, their current needs, what they would like in terms of future goals and future needs as well? Is there something more that we can be doing? If I'm doing that well as a speech pathologist, are other members in my team, do they have the knowledge and the education to be able to facilitate those stories as well? Because with narrative ethics, we're often talking about having a voice, this particular approach really has a temporal sort of approach as well. So we're thinking about not only what's the issue now, but what went beforehand. What's the background to this issue? What could have led us to come to this particular point in time? If we're focusing on a client, what things are really important to that client? It could be a cultural background, could be medical background, it could be their previous experiences with health services. Then we need to really think about what would be the current story for the client from their perspective. So what do they see as the key concerns or the major areas that need to be addressed? And then thinking about the future. If I do option A, what's the likely impact going to be on that client? What do they think about that as a potential consequence of our actions? If I chose option B, what may be the future consequences of that particular action? How does the client respond to that as a possibility? With this particular one, again, what we'd be thinking about is our values within the Code of Ethics as well. And in particular, we'd be talking about autonomy and empowering clients with the information that they need to be able to support decision making. So with each of the 4 approaches, we've talked about and referred a little bit to the Code of Ethics, and would really encourage you to actively use the Code of Ethics during this next section of the workshop. That little bit that I've just done now is about, I guess, ethics in theory, and the next part's going to really be about our ethics in action, where you're going to have the opportunity to try implementing one of those approaches yourselves. There's a few things that I'd like to say before you get stuck into this next section. First of all, what we're not trying to do this afternoon is to come up with the one right answer. Okay? What we'd really like you to do is to engage with the framework around the table for people to try and offer as many thoughts or ideas or perspectives as they possibly can to help you to understand and unpack the ethical dilemma a little bit more. None of the approaches are the right approach. There's some real strengths in each of the 4 approaches that we'll be talking about this afternoon, but you may find that one approach aligns a little bit easier with different forms of ethical dilemmas. And that's why we're going to give you the opportunity a little bit later on to swap and to hear about each other's experiences. As you go through the exercise, remembering to think about the logbook. I think I could hear that some of you were already just starting to think about your own experiences with ethical dilemmas, even in that first section of the workshop. So you've already made a little bit of a start there. And as you're working through, I think, your frameworks, it will probably bring to your mind perhaps how closely the scenario may reflect either something that you've experienced yourself at work, or it might bring to mind perhaps some different types of ethical dilemmas around dysphagia that you've experienced as well.
That was really interesting, just going around listening to some discussion about the different approaches. Some tables said, well, we'd actually use this approach and another approach because it gives us a wider foundation, more information. Another table said, with this scenario, we think this approach is better, and gave the reasons why. Another table said, if I was presenting this to the hospital board, I'd probably use the facts-based approach. If I was presenting it to Speech Pathology Australia, I'd probably look at the principles-based approach. So there's a whole lot of interesting information that came out of that sharing, which is great. It just gives you an idea of at least 2 approaches, and of course there are more. And nobody gets it right. Of being on the board, the committee, when we get cases, we argue. Is that really what we're looking at here? Is that the breach? Is that where the Code of Ethics is breached? What about, what about? So it's not cut and dried, it's not black and white. And thank you, people have been filling in the logbooks, which is great, and I've heard some lovely stories going around as well. So one of the major messages is to know your code, because it will help you if you're stuck in that situation. And I heard a lot of people say, this scenario is very similar to something that I have experienced or that I know about. So make sure that you look at your Code of Ethics. These are 2 quotes. I'll just let you read them. We have to think and act ethically every day, not just when a crisis occurs. Actually, if we think and act ethically every day, we're much more likely to avert a crisis. But you can't avert all crises. So what we need to do is make sure that we're ethical practitioners. And in particular, we need to look at our protocols. We need to look at our routines, because sometimes it's not us. It can be the workplace. It can be the environment we're in. It can be the external factors. It can be people we're dealing with that affect how we are operating ethically. So we need to take the ethical road in disability practice. How do we do that? Well, Kathy Olson is the Disability Advisor at Speech Pathology Australia, And she's been compiling a list of issues concerning the NDIS and disability, including dysphagia. From today, and there's a lot of logbook happening, I'm going to take those issues back to her. But we need to look at how we're going to assess and how we're going to treat dysphagia ongoing with the advent of the NDIS and with different changes in our systems. It's already come up that there is a lack of speech pathologists available to do complex dysphagia assessment, complex dysphagia training, complex dysphagia intervention. This is a known negative area, negative supply area. If you want to go into that area, I guarantee you will have a lot of work. But it comes with its own challenges. It comes with its ethical challenges, and it comes with challenges of legality, duty of care, and so on. So you also got in your handout this morning some handouts from our association, professional association guide, which talks about challenges for you as a professional and your legal responsibilities and support. So that is something to think about. Ongoing, I think we really need to think about our supervision and collaboration as speech pathologists. Even though people might be in competition, this is such a small area. Well, it's not a small area, but it's a specialised area that we need to support one another. Whether we are in competition as private practitioners, whether we're in non-government organisations or government organisations or community organisations, as speech pathologists, as professionals, we need to collaborate and support each other. Sorry, something seems to have happened and the computer has gone off. We've got some contact information and we also have some references available. But what we'd like to do now is just open up the mic for the room so people can ask questions or give comments. If you've also, we might give you a few minutes to continue your logbook if you've come up with some other examples. So any questions first of all?
We'd like to go just in the concluding sections of today. You've had an opportunity to do a lot of discussion and analysis of different frameworks and to think about ethical dilemmas that are relevant to your own practice. The other piece of paper that we'd like to draw your attention to on the table is your action plan. And I think one of the really important things when we come to something like an ethics workshop, because it is philosophical and theoretically based, that it's often really important that we go away with something to think about that we can directly apply to our own workplaces. So what we'd like you to do now is to take about 5 minutes to think about your own professional action plan. Have a think about what you've covered during the workshop this afternoon, the discussions that you've had with your colleagues here, the two frameworks that you've had an opportunity to think about, and perhaps think about how could I apply something from the frameworks that I've implemented this afternoon directly to my workplace? Or perhaps what is there about ethics and ethical practice that I could reflect on more or think about more or discuss within my own personal work setting? And what we'd like you to do is to perhaps come up with at least 2 or 3 things from this afternoon that you think you could practically and directly do when you get back to work on, let's say, Thursday, Friday for most of you.